Hi, my name's Liz. I'm a GP in Birmingham and I'm going to talk a bit about how I got involved in the other work that I do, which, to be honest, it isn't really separate to my general practice work. But you've noticed, if you've had a look at my website, that I've done a lot of other training in the field of health and how people get well. And that's been tremendous fun. I've really enjoyed that. And I've trained with some really great people. But why? You know, why would I, a GP, be interested in this? Well, why not? I suppose. I'll tell you a little bit about how I got involved in this. And I've been working for the NHS now for 17 years, and I've been a GP for 10 years. 10 years. It seems like yesterday when I qualified. And when I was at medical school, I was blessed with a really good memory, and I really enjoyed learning about all the different causes of diseases. And I liked that. I felt very capable. I felt very I loved all the new things that I was learning, and I knew all the causes of the different illnesses. I knew about all the different treatments. And when I came to treat patients, I found my knowledge really useful, because people would come in and I would be able to help them. I'd say, well, it could be this, or this is the cause of this, and these are the treatments for this. But particularly when I came into general practice, I realised that a lot of the patients I was seeing had conditions which were quite complex. They'd had them for a long period of time. And as doctors, we follow clinical guidelines. I've got a book of them just off camera, which I won't show you, but it's a really thick book, and it's got all the guidelines, the suggestions for treatment. And if someone comes in with a particular problem, we go to the guidelines and we treat based on those guidelines. And that standardises care. It helps ensure that doctors throughout the country are using the same guidelines, and the guidelines are what we call evidence-based. They're based on trials, they're based on studies that have been done, and they're very comprehensive. And I found that a lot of the patients I was seeing, I was following the guidelines, and we'd investigated them, and we'd ruled out conditions such as cancer. We'd ruled out the kind of conditions which are life-threatening, which shorten people's lives, and we prescribe certain medications. But I found a percentage of my patients were not getting better. A lot of them had conditions such as chronic pain. They had problems with the functioning in certain organs, for example, gut functioning, gastrointestinal tract functioning, such as irritable bowel. They might have had intractable headaches, many conditions like that, and often the investigations were normal, but these patients were still distressed. They were in discomfort. Their symptoms were very much, they were real. And I remember going through a phase. I think it was a few years ago now, when I started to think, well, actually, how can I help these people? I started to get a little bit frustrated with the fact that I didn't seem to have any blueprint, any tools, anything to help people other than the medical guidelines. And I became a little bit frustrated in my abilities for a doctor, as a doctor. I hope people will forgive me for this. And I started to think, well, actually, what can we do here? And I noticed that a lot of my patients, or some of my patients, would get better, and they wouldn't come back to see me. And occasionally I would see them for reviews, and I'd say, well, what did you do? What did you do? How did you get better? And they would tell me. And that was really interesting, because I realised that actually the human body has an immense healing capacity. It's got a self-regulatory capacity as well. And that was really interesting to me. And I started to get curious about how people were getting well. And I realised that there were other people in the country that were doing the same. And I remember I was chatting to a friend one night, and she was telling me about NLP, neuro-linguistic programming, which was co-created in the 1970s by Dr. Richard Bandler and John Grinder. And she said, "Oh, haven't you learnt about this?" And I went, "Well, no." And she said, "Didn't they teach you at medical school?" And I went, "Well, no." So I thought, right, I've got to find out a bit about NLP. So I went to the internet, went to a certain online bookstall and bought most of the books I could find on NLP. And that really interested me, and I started using some of the techniques in practice. And then I came across the work of Garland Thompson and the Society of Medical NLP, who were doing some fantastic work, and still are, himself and many of the health professionals and allied health professionals that he's trained. And they were looking at how people got well. They were looking at language as it was being used in the consultations. They were looking at ways to help people become more flexible, to get well, or even if the disease couldn't be cured, that people were enjoying life more, they were able to cope better with stresses and strains. And that was fascinating. I mean, that was absolutely life-changing. And I started to bring a lot of the techniques and the spirit and the principles and the whole, I'm just trying to think of a word, I can't think of a word at the minute, but the whole sort of spirit of medical NLP I brought back to working with my patients, and we had some fantastic results. And so that was fascinating. I also trained with Georgie Oldfield, who's a physiotherapist up in Huddersfield, and she's worked with John Sarno, who's a physician in the US, now retired, who worked with a lot of patients with chronic pain, and he was very, very successful in looking at the emotional causes of chronic pain and helping patients to resolve past traumas and things that had happened in their lives. And everyone is unique, every patient is unique, and this approach that I use is very much a whole person approach. I found very, very quickly that we can't see people's conditions in isolation. We have to think about the type of social relationships they have, the quality of those social relationships, exercise, diet, nutrition, stress, which is a biggie, sleep. All of these factors come into play when looking at the person from a whole person approach, and it's tremendously rewarding, because rather than looking at disease, we're actually looking at health as well, and helping people to function better and more effectively. Recently I did some training with Kevin Lay, who's a therapist in Shropshire, and he has pioneered a number of very, very quick techniques which are very useful for a time-strapped GP such as myself. I think we get 12 minutes to see a patient. I wish it was 25, but sadly we only get 12 minutes. So this is really, really helpful. His techniques have been really helpful for helping people get very quick results, helping people, giving people power back, saying, well, actually, if you do this, your anxiety will reduce pretty much instantly. And that's been, his work is called SciTap, if you want to look it up, and it really is fantastic. And I suppose personally I've benefited massively from many of the modalities that I've trained in. I've managed to overcome a number of struggles of my own, and been able to cope better and more effectively through learning those techniques. And I say techniques, but it's actually more than techniques. It's an ethos, it's a spirit, it's an attitude, it's many things. And that was really why I came up with the name Boundless Flow. I'd struggled. I thought, what can I call this? And boundless is really, the word boundless is very much about connectedness. It's very much about extending out from the person into the person that we're trying to help, and it's very much about bringing people together and about helping people to become more connected. I mean, that really doesn't do it justice. There's more to it than that, but that was the general ethos of it. I wanted something that was bigger than me, and would affect other people, because often if we help people, they will often you know, they will become happier, healthier, more adjusted, and they will have an impact on people that they have contact with. So it's a kind of a virtuous circle. And flow is again the being in flow is this effortless functioning in everyday life, and that's something that I've been lucky enough to experience. Not all the time, yeah, that would be fabulous, but certainly more frequently than I used to. And that is just fabulous when that happens. We're able to function more effectively. We're able to function easily and enjoyably, and it just makes life pleasant and a privilege really, and humbling at the same time. And it's a real joy to get out of bed in the morning. So that's a little bit about how I came up with the name. So that's in a nutshell. I mean, I could go on for days about this work, but I don't know whether YouTube would allow me to put that amount of stuff on there. So thanks for listening, and yeah, if you have any questions, please direct them to my email, and I'll answer them for you. And just real privilege to talk about this work and share it. So thank you.